Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Scott Nichols, who's the CEO of MyMedicareQuestions.com, has some very important information to tell you. I told Scott before when we were talking, I wish I had known him many years ago because I decided I didn't need to take any prescription plan. And so eventually when I decided I better do it, he'll tell you what happens. And so please don't make the mistake. Call him and get it taken care of now. So go ahead, Scott.
Well, specifically talking about the prescription drug plans that you're talking about.
Right.
If a person has to come in and they have to qualify for a prescription drug plan under Medicare, the situation is that a lot of people don't understand that the government has put in what's called a voluntary mandatory requirement on that drug plan. There are some exceptions, and I don't want to take up too much time with the exceptions, but there are exceptions. Like if you have a qualified veterans plan or if you have a qualified plan from work where you retired, those are exceptions. But for the average person out there, once they cross that threshold and get enrolled in Medicare Part A and Part B, they're required to pick up the Part B coverage for their prescription drugs. If they don't do that and they wait and they just let it go, there's a penalty involved in not doing so. The penalty is 1% of the national average cost of your drug plan. It's tacked onto the premium of that drug plan. It stays there permanently. So you're always paying that penalty. So there are options out there where you don't have to take an expensive plan. There are very inexpensive plans available in the market, but you need to get with a certified local broker who can talk you through that, and that's exactly what MyMedicareQuestion.com does. It connects the senior with a local certified Medicare broker who can answer their questions and talk to them about this so these mistakes are avoided.
Well, I'd like to turn the clock back maybe 15 years. What happened is because, and I'll just share this, it was so perfect when I heard that we're going to be working with you because I don't want anyone else to make the mistake I did. I'm not on any medication. I haven't been. I'm very healthy. And I said, why should I spend money, right? And I said, okay, and I didn't. And then 5 years later, and I didn't. And I said, I kept saying that to myself. And then even though I just started taking one medication for just a very, a month, I said, well, I guess I better take it. And everything you said came true. I said, what?
Right. The big shocker, the big wake-up call.
Right. So you said something very important. So, okay, you don't have to take the biggest and the best drug, the RX, prescription plan, but you can take something, right? So as long as the government knows you're enrolled, that's all that's important.
That's exactly right. And what I tell people is whenever, our brokers tell people, is that this is a one-year buy. When you get involved in Medicare Advantage plans or even Medicare Supplement plans, you really have to keep in mind it's a one-year plan. That doesn't mean the plan's going to go away. It just means that once a year you're going to sit down and review that plan with a certified local Medicare broker. You need to look for that. You need to look for an independent, certified local Medicare broker, and that's what the MyMedicareQuestion.com site is all about. Our site collects no data from the senior. We did a lot of test marketing on this before we put the site up. And almost to a man and a woman, they don't want to give any data, and I don't blame them. I don't either, right? So we collect no data. When you go into the site, you don't have to fill out anything. We don't ask you your name, your address, your phone number, any of those things. The site is for you and your freedom. You're the one that's going to reach out and contact that broker. They're not going to contact you. So when you go into the site at MyMedicareQuestion.com and you select your state, you're going to select your closest, nearest major city. And then a list directory comes up of brokers. What's nice about that is we've listed not only their name and their phone number and their email, but also some of their hobbies and interests, so that you might have something in common with them. And many of our brokers do actual client testimonials where you can click and watch a video of what the clients are saying about this broker so that you have an idea. We always invite you to talk to one or two of them and see which one makes the fit. But most importantly, Anita, like you just found out, right? You got to reach out and talk to somebody so that you don't have an error that costs you money.
That's right. Don't be so smart, right? Because you got to go to the experts.
Well, we're all like that.
Yeah, but you're an expert, and I am so glad to see that we're going to be having a relationship for us to be able to help our seniors here. So when you were talking, so if this is all over the state of Florida, how far do you reach?
Well, we are rolling out the MyMedicareQuestion.com website. Eventually, it'll be in 49 of the 50 states. We're not doing Hawaii for obvious reasons, because my wife probably won't let me go travel out there to do marketing, probably, but without her, right? But we're doing 49 of the 50 states, so we're doing the continental U.S. Right now, we've rolled out Ohio, Tennessee, Kentucky, Georgia, and Florida at this time. Texas and some of the other states, California, seem to follow. So we wanted to make sure that we were at your upcoming expo so that we could make that introduction to the people in Southeast Florida to tell them that we're here. So anybody that's listening to this in the state of Florida will have access to the directory. The directory pages for the agents, as we roll them out this month, will go, it's live now, but it will go very live with all the brokers involved in the program by the first day of April, and that'll be a wonderful thing. You'll start to see our ads and hear our ads for the site on Fox News, on your radio station, and on other radio stations and online newspapers, local and national throughout Florida, so that people are going to know this resource is available to them.
That's excellent. And can I just ask you a little bit about yourself, why you got into this?
Oh, please. I have a long history in the insurance business. I actually started in the insurance business under an escalator at Sears with Allstate, if anybody remembers those days, in 1984. And I sold the auto and the home and the typical insurances you would imagine, the life and things like this. And then I started to be more interested in health insurance products. Around 1987, I was offered a job for a health insurance carrier that also did Medicare products. And I worked for them up until 1992 as an executive. And then in 92, I decided to make a break and open my own brokerage that concentrated only in the Medicare space. A lot of that has to do with my research into demographics. You know, it's easy now in the year 2015 to look back on those demographics and look at the demographics today and say, oh, that's obvious. But to me, back then, it was something that was kind of cutting edge because not that many people were out in the Medicare space selling. And so I opened up my brokerage. I've always been a wholesaler, and I started wholesaling Medicare products to insurance agents across the United States. That takes me up to about the year, 2003, I believe, when the Medicare Modernization Act came along and Medicare Advantage came into the space. And I am a fan of Medicare Advantage. I think it's a wonderful program. It is not one size fits all, but it's a wonderful, wonderful plan for people to have a type of plan that suits their needs. So we got heavily involved then in promoting and educating agents on the Medicare Advantage. And so now it brings us up to this date. About 2 years ago, I started test marketing this idea for MyMedicareQuestion.com because I saw that there was a gap. There was a gap between the seniors who was, or even below senior, the person that was a Medicare beneficiary, because a lot of people can get help that aren't in the Medicare A and B space. But there was also the broker, and I saw them apart. I saw them not connecting. The carriers were trying to connect to the senior or the Medicare beneficiary, but the agent who was independent and not just representing one company seemed to be blocked from making that connection. There needed to be a platform, a vehicle, to make that connection. So I started test marketing it in my home state of Ohio, this resource, and we started to advertise it to seniors. and it took off like a flash. I'm proud to say that in our time just this year alone, we have connected Medicare beneficiaries to the independent certified local broker in over 1,000 cases.
Really?
And we know, yes, and we know that's going to build even more. And when we go out to get testimonials from these people, we have our own videographer who does testimonial videos. It's not required, but it's always nice to hear what people have to say. They are just so fast to say, I'm so glad I did this because now I have somebody local that I can talk to and can handle this situation, answer my questions.
Well,
I would like to bring up one thing additional that really shocks me.
Okay.
And it shocked me quite a bit, Anita. I think you'll find this fascinating. We just recently started to advertise this resource on Facebook, in the advertising space on Facebook, and I didn't really have an opinion of it. I didn't know what it would do. So we took our actual television commercial and we put it on Facebook. And I got to tell you, last month, now that is being out in Facebook in the states that I mentioned to you, okay? 17,000 views of the commercial just this month.
I can't. Wait. Come on. Are you on something?
I feel like I am sometimes, right?
Isn't that fabulous?
It's amazing. And what it does is only reinforces what I just said. We got 35 million people turning 65 this year, excuse me. Of the 78 million baby boomers turning over the next 18 years, almost half turn in 1 year. And so if you think about that for a minute, who's going to help these people? And so where are they going to get finding information? So that's why I thought this was important to do.
Yeah, it sounds like you really hit it. That's great. Sounds like you're a very smart guy, and I heard some nice things about you, but I really want to pursue this more. So so you said that there were different Part D RX plans. It's not the same for everybody.
Right.
And how does that change? How do you know what is right?
Well, I think the only way to really know what's right is to get with a local certified broker. I have seen people go out and go onto the government site, that's with CMS, which is the Center for Medicare and Medicaid Services, the federal government, and try to do it themselves. And some are successful, but a lot of times they're more confused. I know that the certified local broker will also use that tool, but they go through an immense amount of training to be able to decipher the situation for the Medicare beneficiary. So a lot of people don't understand that these brokers have to go through 30 hours of continuing education training every single year to get recertified to talk to a Medicare beneficiary about these plans. It's not one and done. They don't get licensed and hit the road and start talking to people. They have to, every year, take these certifications. And on our site, at the MyMedicareQuestion.com site, there's a tab at the top that says, what does it mean to be certified? And I actually wrote that and put that on there because I thought it was important for people to understand when I use these terms, certified, what does it mean? Every year these agents have to take these classes, and they must score a 90% or better on the exam for AHEP, the Association of Health Insurance Products, or plans, in order to be able to continue to sell that next year. So your question of, gosh, how would I know, right? The best way to know is to get yourself a list of your medications, and even if you don't have medication, go ahead and sit down with a certified local broker and say, what's best for me? There's plans out there that range from $15, and there's plans that go all the way up to $100, depending on what's going on with you and your medication situation.
I see. So someone that's on a lot of medication would want a different plan than someone that as I was, with nothing.
Absolutely. And with my parents, my mother died in 2006, and my father's still alive. He's going to be 92 in August.
Congratulations.
Oh, thank you. We're pretty proud of him. But every year I have to sit down with all 29 of the pills he takes. Okay.
No kidding.
29.
No
I'll tell you
kidding.
that.
Wow.
29 is the pills he takes, and we have to go through and look at this because that's the only way to figure it out. Now it's interesting in the website that the government has. You can plug in your medications, and it will put all your plans together, and it will tell you what's what. It can really confuse you if you don't sit down and talk to an expert who's going to be able to decipher which plan is going to be right for you, because they have different ways of treating medications in different tiers from with each carrier, and each carrier has a different price point. So there's a lot of variables there that have to be addressed.
My goodness. Well, this is wonderful to have you involved because you're right. There's huge amounts of people, and many of them get their information from their neighbors, around the pool or playing cards or somewhere.
Right.
And then there are a lot of people out there who all have different opinions, even people in the business. And unfortunately, not all businesses are as responsible as it sounds like yours is. And so we're very careful who we really want to work with also. So I'm glad that you've kind of joined, come into our stable, as I call it. So there is something that you said that I think is really, really important. What if someone they're not yet 65? Should they be talking to someone ahead of time?
I think that they should. I guess if I was to talk to some of the people that are in the 62-year-old space,
right,
they would tell you that their mailboxes fill up pretty quick with material, and it becomes quite a hassle for them. And I completely understand that. Yes, they need to be reaching out and talking to people. Better early than late. It's not something that a decision you want to rush into by any stretch of the imagination. And I leave it up to everybody's comfort point. The advertising and the marketing that we are doing to promote the MyMedicareQuestion.com site, our demographic, we actually start at 60 and move up. So we are reaching out to people that are well before they're 65 years of age, because we feel that it's important for them to start that education process early. And that's a matter of just being comfortable, and it's never too early to reach out and get a good advisor, right?
That's very good advice, and I think that there are different kinds of people who will jump in and find out, or some people will wait. But there's something that you also said about people who are veterans. So what happens with those people?
Okay, well, the veterans, if somebody is a veteran and they are receiving their care from the Veteran Administration, and that's what they want to do for their prescriptions, they are completely qualified and get an exemption from any type of problems with Medicare Part D, as far as we talked about earlier, the penalty. The nice part is we do treat our veterans right when it comes to Medicare Part D. They can just have their veterans service medications covered there, or they can also put on the Part D drug card. They can have both. And my father's a veteran, served in World War II, and he has both. So he's actually in a veteran's home. Now, of course, we have to be careful here because every state runs their Veterans Administration, right? So every state, and I tell people, you got to check with your own Veterans Administration in your state. But every veteran's situation is going to have a situation where they can have their drug card with the with the Part D, and they can also have their drug benefits with the veterans at the same time. My father's in a nursing home in Georgetown, Ohio, Veterans Nursing Home. A lovely facility. It's a beautiful place. He's well taken care of. My wife and I are there, and my brother are there every week.
Good for you.
Visiting him.
Good for you.
And they're wonderful. It's a wonderful, wonderful place. And I know that as we sit down, we go through his 29 bills. A lot of times things get changed around, and so we compare. What's the veteran benefit? What's the Part D benefit? Which one's going to be best for Dad? And then that's how we make our decision. So the veterans have the best of both worlds, and we all know they deserve it.
That's true. But let me then pursue this. So let's say someone works with one of your representatives and then they go with a particular prescription plan. What if that isn't the right one after 6 months or a year? Do they help them change that? And can they do that?
Okay, so this is where the government comes into play. Yes, they will help them do that, but there's only certain times of the year that can be done, unless there is what's called a special election period. And for drug plans, you really don't have a special election period if you're in a Part D plan, because usually these plans are filed for all 50 states. So like moving out of an area or something like this wouldn't apply, which would be a special election period. But it does happen, and this is why it's good to sit down and talk to a representative, because we do talk to people occasionally, and usually these people have either, most of them have gone out and done it themselves, and they'll get involved in a plan, or what else will happen is their health will change. And we all know we don't want that to happen, but it does happen, and they'll come down with something serious, and they bought the cheapest plan. So maybe their health was fine, and they bought the cheapest plan, and now they become ill. So not everything's perfect, right? So
right.
Those people would have to wait until the next annual election period, which would be in October for a January 1st effective date. And then they would be able to switch plans at that time to a better plan. But you can't switch in and out of plans unless you meet certain criteria, and that would be if you were Medicare and Medicaid dual eligible. Then you could switch around plans anytime you want to. But for other people that aren't in that space of being what's called dual eligible, they would have to stay on the plan that they're on until the next annual election period.
I see. So the election period not only covers when you can choose an HMO or a supplement, a Medicare supplement, but it also applies to just the RX, Medicare, the drug program too.
That's correct. So it applies to that, but I do want to make one correction, something you said on Medicare supplements. Medicare supplements can be changed any time of the year. Okay, so we have to make the distinction between a Medicare Advantage plan and a Medicare supplement plan. They're not the same. Medicare Advantage and Medicare Part D are part of the Modernization of Medicare Act, which fall under the rules of CMS, Medicare and Medicaid. That gets into your election periods and all the things we discussed. A Medicare supplement does not have the drug card with it, does not have drugs included in it. A Medicare supplement can be changed at any time.
I see. Okay, well, that's just something else to add to this. So the thing to do, and I'm just going to give people your phone number because I think it's important that they get in touch with you. Now, you said that you had a lot of activity on Facebook, but let's see. So I have actually a phone number for people to call, and I have your website, and it's mymedicarequestions.com. Is that what they should do to go on your website?
Yeah, they can do that. Absolutely. One other thing is we have an 800 number.
Okay.
That is 844, then the number 4, me, ABCD. So.
Okay, wait, let me do that again.
It's a cute little number.
844, then a number 4, then an ME, then an ABCD.
Exactly.
Okay, and they could call that if they don't want to go on the web, but that's the phone number. Now, what about getting, if they were to you said on Facebook, if they have a Facebook account, what would they get on to get to your Facebook?
Facebook is the same thing. Just go into Facebook and look up mymedicarequestion.com.
Okay.
And it's a Facebook page in of itself. We're very proud of our 415 likes.
Oh, my gosh.
We started the Facebook page in February, and we're very proud of that. And
you should be.
You'll see, we also we do a lot of expos and events because we are constantly trying to take our brokers that are local and certified and part of the program here and put them as close to the Medicare beneficiary as possible for them to be able to ask questions and get them answered. Your fantastic expo coming up in July is part of that program. We do those as much as possible. So you're going to see an events tab on our site, and if people would like to see where we are and where we're going to be, they can click on that, and it does the same thing. It walks you right through the state, right through the city, and you can find events that we will be at. I'm a big proponent of that because I've also found in this, Anita, is that by us doing these expos and events, many of them in the over 50 crowd, like myself, usually these events have good causes behind them, really good causes.
Right.
And some of them really touched. And we have an uncle that I love dearly who's got the Alzheimer's, and we like to go and do Alzheimer's events and do things like this because we think these are important things to do. So we're trying to transcend it a little bit. We're trying to answer questions, put real certified people in front of the Medicare beneficiary, get the questions answered, and make ourselves accessible. So Facebook's been a big deal for us. It really has, but that's where you would go, MyMedicareQuestion.com on Facebook. And hey, like us if you wouldn't mind. We like those likes.
Well, I'm going to do that after I get back from the radio shows. But let me also explain that I'm so glad you're going to be at the Boomer Expo, and I'm sure that Leonie, who is the Expo manager, told you that we do dedicate it to the veterans.
Yes, and we're very happy about that.
Now, will you be there? Will you come?
Oh, I'm trying to plan to be there for sure.
Okay.
I'm going to do everything that I can. I'm definitely sending my troops down, and more importantly, we'll have those local brokers there to answer your questions and talk to the people that'll come and be in attendance. It sounds like it's going to be a very exciting show.
Right.
You do some pretty unique stuff at that show. I thought it was fantastic.
Right.
Like I said, we do a lot of these, and
Right.
yours sure sound like it was the cream of the crop.
Well, with that, we're going to get back to you another time. Thank you so much for taking your time, Scott. We've just run out of time. And everybody, make sure you go to MyMedicareQuestion.com, and then you'll be able to see what they do. Thanks, Scott.
Thank you so much, Anita.
All right. Bye.
Bye-bye.